In this video I will be discussing the condition wet macular degeneration, and it would be sensible to review a previous video of what is macular degeneration and how does it develop prior to viewing this video. Wet macular degeneration is less common than dry macular degeneration and is approximately 10% of patients with macular degeneration, but unfortunately tends to produce more severe visual loss than the dry form of this condition. Most patients do have a degree of dry macular degeneration prior to developing wet macular degeneration, and what happens in wet macular degeneration is that abnormal blood vessels develop from the deep blood vessel layer called the choroid and grow into the retina and under the retina and can hemorrhage and leak within the retina, causing blood vessels to rupture and causing waterlogging of the retina. In order for us to see clearly, we need to have a dry retina, and if you suddenly develop swelling within the central part of the retina and get a bump in the retina, you get a bump in the world. And that's the reason why distortion of vision and blurring of vision are the symptoms associated with wet macular degeneration. And this process can occur quite quickly, so people can suddenly notice a deterioration in vision in association with wet macular change, compared to the dry form where it's a more gradual process. I think about wet macular degeneration like a cut to the skin. The first thing that happens is you get swelling and inflammation and redness and hemorrhage, and then gradually the swelling reduces and a scar forms. So a similar process can occur as part of the natural history of wet macular degeneration. You get abnormal blood vessels developing, hemorrhaging, leaking, causing swelling, and then they will gradually fade and the swelling will reduce and you'll be left with a scar. Now a scar in the skin is a cosmetic blemish, but a scar in the centre of your retina will cause a significant loss of central vision. So it's very important to try and treat wet macular degeneration as soon as possible to try and reduce the swelling quickly, to improve the vision and also minimise the scar that may subsequently develop. In order to assess whether you do or do not have wet macular degeneration, there are two investigations that are needed. The first is a fluorescein angiogram, which is an injection of dye into a vein in the arm. The dye then circulates throughout the bloodstream, including the blood vessels at the back of the eye. And if any abnormal blood vessels growing from the choroid, which is seen in wet macular degeneration, are present, then these abnormal blood vessels leak the dye, so we can visualise the abnormal blood vessels. And this confirms a diagnosis of wet macular degeneration. There is also a procedure called an OCT, ocular coherence tomography, which is requiring just a simple laser scan of the back of the eye, which can see any swelling and waterlogging of the retina in great detail and does not require any injections. It is totally painless and without any injections being required at all. And this OCT examination is often repeated very frequently as wet macular degeneration is treated and seeing whether there's been a good response to treatment.